I now call on the member for Bowman.
Deputy Speaker, this nation's efforts to close the gap was probably one of the truly important pursuits that unites both sides of this chamber and, of course, chambers all around this great country, with state jurisdictions doing great work as well. I want to make an observation about where Close the Gap is heading, because we've heard a lot about the extra investment in closing the gap, but still not enough of a focus on outcomes. My great concern is that prime ministerial reports that happen every year, and I hope they'll continue to, do clutch at small glimmers of hope, but in a context where hospital investment has nearly trebled, in a context where we now have billion-dollar investments, what we're not seeing in places like Alice Springs, in places like Palm Island, in places like the Kimberley, places like the Gulf, places like the APY, we're yet to see the community transformations that particularly see young children given a start early in life. And if there's one area where I think everyone would agree, it would be that. I mean, every Australian citizen would believe that a child deserves the best possible start in life. There's no cultural disagreement on that. It's a social norm that transcends our boundaries and goes right around the world. So what we know at the moment is that children are still not going to school in adequate numbers, and there's basically a division between whether this is a responsibility of education or the police. We have an issue still where alcohol is yet not agreed between major jurisdictions, let alone communities. And my strongest recommendation would be that fundamentally alcohol is something that can only be available in any community around the world if it stacks up on social impact. And the social impact is quite simple. Do kids go to school? Are youth getting training, and do people have jobs? And if alcohol reaches a point where it prevents that, then it doesn't cross any bar for social acceptability. We have an expectation of a community that there is roughly 2/3 workforce participation for healthy adults who aren't caregivers. And that is a number that I think every community aspires to. No community anywhere in the world survives if it doesn't achieve a certain level of workforce participation. It's economic engagement, 101. We can talk about delivering services to people's door, kicking the door in and going in and changing their lives, but as zealous as we get about these programs, ultimately there's only so much you can do with services. Ultimately, you have to create the opportunities, an environment where people can have a go. Now, it's very interesting that this year, Australia's Aboriginal population will reach 600,000, and 100,000 of those live in what I would call remote and very remote locations. 500,000 Aboriginal Australians now live in cities and regional towns. So we're seeing a complete shift in the demographics, and with that goes political power, because 500,000 Aboriginal Australians will be demanding better services where they live, and I don't blame them. But the answer is, Deputy Speaker, if we're going to close a gap, no gap will close without closing the remote gap. Let's not forget that. In a context where there's multi-layered and many poorly coordinated services in urban areas, we can work on that one. That's a doable challenge, a problem that I want to have. But the problem I don't want to have is no services. The problem I don't want to have is no doctor in a community. The problem I don't want to have is not being able to get good teachers to the local schools in remote areas. Now, let's be clear, this is a uniquely Australian challenge, okay? Canada potentially has the same challenge, but not to the same degree. Australia is the second most sparsely populated continent in the world, and we have the second best health system. So we will always have a fantastic challenge, a massive challenge, huge expectations on our workforce to go out and do the tough jobs where most of us would never even conceive living, let alone working. But we have a health system that will push out professionals to deliver those top-class services. Now, that's a challenge for Australian lawmakers. Fine. But in the end, what we need to remember is we must not pat ourselves on the back because the age-standardised death rates of Aboriginal Australia fall slightly from 2,000 per 100,000 to 1,500 if it's mainly being driven by self-identification of mostly healthy, urban living Australians who are identifying as Aboriginal at very, very high levels. 45% increase since 2001. Now, it's not all birth rate, okay? It's self-identification. So we need to examine true birth rates and acknowledge that the population in most remote and very remote areas is virtually stagnant. Okay, if you look at the 1% growth in remote Queensland, the 2% growth in remote Northern Territory, the fall in remote WA and the fall in population in remote South Australia, it's roughly a 100,000 person problem that we have. But a massive challenge that I fear with the current Close the Gap agenda, we are not addressing because we're simply taking national figures. Perhaps it's a time to look specifically at the remote gap. Perhaps it's time to stop saying we're simply delivering better services in urban areas and by simple weight of numbers, achieving a closing of the gap. Now, Michael Marmot has done really impressive work about early intervention with children. We have the Adverse Childhood Experiences Study from California. Everything tells us that the key window for an opportunity is between the age of 18 months and 5 years. And I commend the government for doing their 5-year-old health check, including a biosocial component to it, but the reality is that 5 years is just too late. The reality is we've already missed the boat at 5 years of age. So the question for every one of us here, both at state and federal level, is what are we doing for young kids from the age of 18 months? Now, I'll be, as a former doctor, say it's not easy to diagnose vulnerable kids at 18 months, but you can certainly diagnose vulnerable families at 18 months. You can identify the families living in poverty, closely spaced children, a caregiver who has either a mental health record or a criminal record, spending time in jail. These are the incredibly challenging cohort we need to identify very early and be unapologetic about delivering them the great services. But at the moment we don't. It's all white noise of health service provision, mostly fee-for-service. You see someone, they go out your door, and basically if things fall over, it's the next practitioner's problem. And there's none of that continuity. Aboriginal Medical Services do a fantastic job, but too often they've got a state health facility down the road seeing the other half of the population, or the half when they get really sick and need to be evacuated out. So it's time in smaller regional communities to have some cooperation between state and Aboriginal community-controlled services, because, of course, communities love having an AMS, but there's no point if you have half the data held at the Queensland Health Facility and no collaboration. Maybe we need to get these systems working together. It's something that Medicare locals cannot do alone. I mean, a Medicare local covering a large expanse of some of these areas is simply too far removed to make a great difference. Look, Deputy Speaker, the last thing we want in our health system, as good as it is another level of bureaucracy trying to talk to other providers. What we need are more people on the ground and unshackling local clinicians to tailor services for their community. Now, it all sounds very glib, but in reality, if we can't get those opaque state community health services talking to the work that's being done in primary health care that's funded by the federal government, we'll just keep having more blame and more blame shift, more gaps and more people suffering those consequences. I would strongly urge both sides of this chamber, if we're serious about closing the gap, let's do the following. Let's agree on earlier benchmarks to measure progress. It's okay to congratulate ourselves on a fall on age standardised death rates, but they've been falling at that rate since 1998, at the same rate. So that's the do-nothing scenario, is the current rate of fall. If you look at infant mortality or death rate targets for Close the Gap, we were going to hit them anyway with the existing slopes we were achieving before we started the CTG agenda. We need closer measurements, more frequent measures of success. Secondly, we need more of a focus on outcomes, not outputs, and certainly not inputs, Deputy Speaker. We need to be measuring just how many people quit the cigs, quit the fags. There's no point measuring how many public health promotions we roll out or community barbecues we put in or people on the ground delivering services. That's fine. That's a bureaucratic output. I need to know how many people quit smoking. This is vital information for us to know whether we're investing money in the right way. And it's a huge amount of money in Indigenous smoking. Third, we need to perhaps look at a new Close the Gap agenda item, a new target. I know that there is a target on employment, but there is no target for economic engagement. And there's a very, very subtle but important difference. It's not enough to soak up Aboriginal Australians, particularly in remote areas, into jobs that are simply created on community that have no fundamental market basis or foundation behind them. We need to be engaging Aboriginal families in the real economy. And everyone around the world is comfortable with the idea that at some stage in your life, you leave your community for training and to get a job. We move. Now, Aboriginal Australians are no different. They have done it too for generations until we created the welfare trap. So I urge both sides of this chamber, if we're going to direct incentives, we direct them to people who do the things we want. Go out and seek training, have a go at a job, give all the culturally safe services that underpin that, but let's support people that have a go. It's no longer good enough to put people through Certificate 2 training in stockman work, none of them get a job, and train another 15 for a Cert 2 of stockman work. If we're not going to place these youth and give them the support to move together in cultural groups and work outside of their immediate country, we're actually not solving any problem at all.
That's exactly right.
Now, Marcia Langton said it so well. She said we have a once-in-a-generation opportunity called the mining boom. Before it goes and slips through our fingers so ephemerally, we need to grasp something for it for Aboriginal Australia. If we are going to transform the wealth under the sands that is fundamentally Aboriginal ground, then let's absolutely work in a forward way with mining companies to work out what low-skill jobs can be taken up by Indigenous Australians planning ahead. If there's one profession, if there's one operation that plans ahead, it's mining. They can tell you their mining timelines for years in advance, with, of course, the potential fluctuation of prices. They can tell you what their operational plans are. Let's build in Indigenous Australians that are living in those regions, number one. Let's set goals, not to pick a few happy faces out of a community and pat ourselves on the back because they're wearing high visibility jackets. Let's actually say every person who lives in that community was given a chance at a job, either with that mining firm or that agricultural operation or something in their region. And if it's a big community, those youth will have to go further. We accept that. But government's job is to facilitate that, because there's no reason why the 35 kids who leave school at the age of 13 can't go into training. They're a relatively small cohort. But at the moment, we just let RTOs swing through on fortnightly flights, stay there for half a day, sign people up and do training that ends in nothing. So we have to have a denominator-based approach that leaves no one behind. If you're a primary caregiver, that's right, if you're a primary caregiver, there's no reason why you can't turn up with your own child to the childcare centre, support your own child and possibly be inspired yourself to do some further education. If you are incapacitated, of course that's fine. If you're a big brother that's actually looking after 2 or 3 young blokes that are going off the rails, that's fine too. There's room for that. But for everyone else, let's give them a shot. And at the moment, we're not doing it. We hear about Noel Pearson's good work. We hear about Twiggy Forest. There's efforts in Alice Springs, but they have massive challenges because Alice Springs is fundamentally the bottom of the waterfall, isn't it? I mean, it's where everyone ends up when they can't live in the community or don't want to, in the hub and spoke, and then you have Alice Springs that basically is the catch-all. So I would put to this chamber, if we have once-in-a-generation challenge, it is to look after the children that end up in those Alice Springs town camps. Again, don't pick out 2 or 3 kids and pat ourselves on the back. I'm saying if you receive a payment from the state, the expectation of receiving a parenting payment is be a parent. Be a parent, come along and be part of a childcare centre that engages you. Yes, I was there last year. I was there last year. Let's engage those children and actually give them the Abacadarian model if that's what the evidence shows us. We know one thing. If you engage these children in roughly 24 hours a week, you don't need PhDs, you don't need master's degrees to do it. If you engage these children in bilateral, purposeful efforts to start them on the road to literacy and numeracy, and let's overlay a cultural component to it. I mean, for goodness sake, put in some traditional language into that approach. But there is no excuse to give up, and there is no excuse to simply say that the parents couldn't muster the effort to get those children along to a centre. If you get a state payment, part of it is taking your kid along and giving them a start in life. I mean, that is a basic, fundamental, positive social norm. It exists in Cape York. And for anyone who has not visited the Arakoon School, I challenge you, go and see young Aboriginal Australians there who will look you in the eye at the age of 8 years of age and say to you, I want to be a fireman, I'm going to be a rescue worker, I will be an ambulance worker. Anyone who says we've lost a generation, I challenge you to go and see what's happening in Arakoon with direct instruction. Because at 3 p.m, those children will still be in class and they'll be asking to stay another half hour because they want to achieve their own objectives. And the teacher says these kids don't want to finish school until they've finished their work. We can keep Aboriginal children at school after lunch. Okay? This old dogma that no one in remote communities will stay in school after lunch is a fallacy that belongs in the last century. These kids are like everyone else. They want a shot. And when you sit down with an Aboriginal child and sit there with their parents and that young boy or girl reads to their parents, there are tears in the eyes of those parents. I don't care what your background is. That is what the state can offer, a chance at a new future and a different future. Those kids in Arakoon are going to change it. They're at 75% school attendance and we still have issues around the other 25. We have in other parts of Queensland and Mornington Island and Doomadgee or others where we've tried, extra IT as an inducement, but ultimately our challenge is the afternoon roll call. Can we engage kids after the breakfast club in the morning where the roll is ticked off? That is a challenge, of course, for school providers in remote areas, for young teachers often straight out of graduation with very little experience, and I say to them, you do the toughest job of all. But thank you for doing it. When you go out there, you are probably taking on one of the great educational challenges, And I congratulate you for incorporating traditional culture and language where you can in that syllabus. For too often we have swung from the extremes, from expunging Indigenous culture from educational curricula to trying to teach nothing but Indigenous language until grade 5. I mean, both extremes were foolish. We can come back and find that middle ground. We can do that and close the gap. We can achieve that in education. We can achieve it in seeing young Indigenous Australians going to university. We will see improvements in infant mortality. We'll see improvements in the death rate that we're seeing slowly drifting away. And this is a gap that Australia can close.
Expired.
Well said.